Hello, I'm Betty Casey. I'm editor of TulsaKids magazine. I'm here with Dr. John Lukeman today. We're partnering with the Children's Hospital at St. Francis to bring you information that you need to know about children's health. Dr. Lukeman is going to talk about flu and RSV and answer all of our questions. Thank you for being here, Dr. Lukeman.
Thank you for having me.
Okay, let's start with flu. Tell us what it is and what are the symptoms we should look for.
Flu is a virus that causes typically upper respiratory type symptoms. Most commonly in our pediatric patients, we'll see fever, headache, sore throat, cough, and then sometimes with flu, we'll also have vomiting and diarrhea as well.
Okay, so we should get our children to the doctor if we see some of those symptoms.
Absolutely. We can quickly do flu testing and potentially other testing to verify it's not another virus or illness, as there can be some overlap between different types of viruses.
Okay, so how can we prevent the flu?
Probably one of the best ways to prevent flu is washing your hands. Washing your hands can prevent spread of a lot of different types of sicknesses. However, flu is also spread through respiratory droplets. So when we talk, cough, sneeze, we spread droplets into the air, and those droplets stay in the air. So I know no one's excited about wearing masks these days, but wearing a mask actually does prevent the spread of flu. And that is one of the reasons over the last couple of years we've seen a decrease in our flu numbers because so many people are wearing masks.
Okay, so maybe wearing masks is not a bad idea. Okay, so let's talk about the flu vaccine. Who can get it, what ages, and when should they get it?
Great question. So the flu vaccine is a great preventative measure. It can sometimes help prevent getting flu, but more than anything, and what I really like to stress to my patients is that the flu vaccine prevents serious illness from the flu, and it prevents, in most cases, death from the flu. So flu vaccine can be started at 6 months old. And so anywhere from 6 months and beyond, anyone can get the flu vaccine. That can be given at a doctor's office or many pharmacies.
Okay, so that's very young. So infants, really, 6 months and older, should go ahead and get the vaccine.
And let me interject real fast. Flu is one of those that it really affects the very young and the very old. And so sometimes I'll have families say, well, I don't want to do the flu shot in my 6-month-old, but maybe next year we'll do it. And I actually say, really, this is the time you want that flu vaccine because it's the little babies that I see that are really ill with flu. And the ones that don't have the flu vaccine, I can tell they are just way more sick.
Mm-hmm. Okay, so that's really important to know. This is a question I have. Can I get my flu vaccine and a COVID vaccine or booster at the same time?
Absolutely. That was something that was a little bit unclear early on whenever we were giving the COVID vaccine, but now they're saying that yes, those can be given together without any complication.
Okay, great. Here's another question that I've heard from people. I've heard people say, I got my flu shot and I still got flu, so I'm not going to get it this year. What would you say to those people?
My immediate response, and I tried to say this as kindly as possible, but yeah, you got the flu, but you didn't die from the flu. And who knows if, something worse would have happened, and God forbid it wouldn't have. But again, the flu shot prevents those serious illnesses that can come along with flu, can help prevent those comorbid conditions, worsening your flu symptoms, and can prevent death from the flu.
Okay, so you may still get it, but it won't be as severe, right? And you may not end up in the hospital. Okay, so let's talk about RSV. This may be a little less familiar to people. What is RSV and what are the symptoms for that?
Great question. RSV is respiratory syncytial virus. It's a virus that is somewhat similar in that it spreads throughout communities. We also worry about the very young and the very old with RSV, but it's one that classically affects babies. And so our babies that are coming in, are especially under 6 months, that are having cough, congestion, runny nose, difficulties breathing, those can all be signs of RSV. And again, we worry when they're less than 6 months old that they may have significant difficulties breathing, where they're starting to get hypoxia or lower oxygen levels, and can sometimes need oxygen support or other treatments to help get through that sickness.
Okay. It sounds like some of those symptoms you mentioned sound very similar to a cold. How do you know if your infant has a cold or RSV?
Great question. And that's a question I get every day in my office. Many times your children that are 2 years old and above, and even adults, RSV will be a cold to us. That's exactly what it is. But the younger patients, when they're getting RSV, they will tend to have copious amounts of secretion. So a whole lot of snot, it'll be draining everywhere off the face. And parents will say, I suction it out, and 5 minutes later, it's everywhere again. And that's kind of one of those key features to RSV, that we can look across the room and say, yeah, that's RSV, because you'll see the mucus and congestion everywhere. And then a lot of times they'll be working hard to breathe, where they're taking these big breaths and their whole body's moving because there's just so many secretions.
So if we see those kinds of symptoms, we definitely need to get an infant to our physician.
Absolutely.
And to be clear, there is not a vaccine for RSV, is that correct?
Not for the general public. There is an RSV vaccine that exists. It is incredibly expensive, and it is reserved for patients that have serious health conditions otherwise. So yeah, it is not available to the general public.
Okay. So some of the ways that we prevent the flu, are those the same ways that we should prevent RSV?
Absolutely.
So the washing hands, masking.
Yes, washing hands, masking, all those things.
Okay, and as you mentioned that it can be dangerous for infants. So is there a season for RSV that we maybe need to be more aware that a child could have it?
RSV season.
Oops. Away. Sorry, we lost Dr. Lukeman.
There we go.
Okay.
There you are. You're back. Okay.
Are we
Okay.
good? Are we still recording?
Yes.
Yeah, it's okay. So we're talking about is RSV seasonal?
RSV is typically seasonal, and it's typically similar to what people think of as flu season. So those fall and winter months. Interestingly, ever since we've had COVID-19 in the picture, our RSV seasons have been a bit skewed. So we had an RSV season last summer, which I have never seen before. I anticipate this year we'll have an RSV season in the winter months again, but we'll see.
If I have an infant, should I ask my family and friends to wear a mask around the infant? Will that help?
It certainly wouldn't hurt anything to have, if you had a baby under 6 months old, for family and friends that are around the baby to wear a mask. That not only can help prevent flu, RSV, but it can also help prevent the spread of COVID.
Okay. Now, I've often thought about that. When people I know that have infants, I think, should I be wearing a mask around them? I know I need to wash my hands, but so what else should we know about flu and RSV? And also the complicating factor of COVID still circulating. What other advice do you have for parents with all of these illnesses? And they're all viruses, correct?
They're all viruses, and I would say most viruses tend to last about 5 days where they're at their worst, and then should improve for an additional 5 days. If your child is just getting more and more sick each of those days, and if it's even worsening after 5 days, it tells me something else could be wrong. And that's certainly the point that you would want to go in and see your pediatrician for a good physical exam, potentially an x-ray to make sure we're not dealing with a bacterial pneumonia or something else in addition to the original virus.
So if you have a question, call your doctor if you're unsure about what your child is dealing with, because it sounds like it could be a little confusing and complicated.
It can absolutely be confusing. It's confusing for even the physicians when we can't always tell you exactly what illness your child has, but we can do testing to come up with the answer. And we can also give a whole lot of reassurance of, we need to see this kid back in 1 or 2 days, or we think you're going to be good and we're going to just give this a few days to watch it and your child should get better. So absolutely, if you're having any concerns, your doctor wants to see you.
Okay. Well, thank you, Dr. Lukeman. This was interesting. I want to let people know that they can read about this topic on TulsaKids website and look for PJ's Corner in the print magazine. If you have health questions that you would like to have answered, you can email me at editor@TulsaKids.com. Thanks again to the Children's Hospital at St. Francis for sponsoring our children's health interview. And thank you, Dr. Lukeman, for this great information.
You're welcome.